Thank you, Jonathan, for that. We have had very good participation among long-term care residents and good participation among the staff in those facilities. And so we can follow up with a little bit more detail, but I can tell you that so these facilities had a choice to either work with one of the federal retail contractors or with one of our state's Phase 1 vaccinators. And we are actively making sure that both systems, I guess, are serving that group and are confident that that's happened. The federal retail contractors, the way that worked is that they had to schedule 3 different clinics in each setting. And so the first one would be for as many people as they could get through the first dose. The second one would be for that second dose plus anybody that didn't make it through the first clinic, and then the third one would kind of be that second dose for those folks that came through the second clinic. After those 3 clinics, our Phase 1 vaccinators will be working with those facilities to make sure that we're keeping up with those residents. If we've got new residents coming in, or if we've got new staff in those facilities. But all told, we continue to be very pleased by the rate of vaccination, and we'll continue to work to make sure everybody that would like a vaccine in that setting can get access to one. Josh, I don't know if we can address the first part of Jonathan's question with the numbers there.
We just continue to report on cases within long-term care facilities. We have seen a decreasing number of cases within the resident population, as well as a total number of cases among the long-term care staff. That is due in large part to the vaccination efforts that we have seen. There's not a direct comparison, with some kind of what's going on nationally, but we have seen some of the data recently in a CDC MMWR that was focused on vaccination, and I can say that we have exceeded what was reported in that report, which was around 77% vaccination for those residents, and around 37-38% vaccination for the staff. And so, we continue to make sure that folks that may have missed their initial opportunity continue to have access to vaccinations, because that has really been beneficial, even knowing that our case numbers have been decreasing. Seeing that drastic decrease in our cases, our hospitalizations, and so on with that population.
Okay.
Can you address the difference between the 3513 number yesterday and 7242 today in terms of long-term care residents?
I don't have that directly. I'm not sure where are you specifically looking at in relation to the website.
Just on the dashboard, the long-term care dashboard.
Okay. I will. We'll get back with you, Jonathan. I've not
thanks.
seen that specific jump yet. So, yep.
Okay. Next question, please.
Jack Cottle, KEVN and KOTA.
Go ahead, Jack.
You talked a couple of weeks ago about tracking any adverse reactions people have had to the vaccine. Do you have an update on whether we've seen any of that here to this point now?
This is Dr. Clayton. What I can say is that, we've not seen any severe allergic reactions due to vaccination. We're also, monitoring for less severe reactions as well, and, we've not seen any that have been specifically identified with vaccination. We do ask that, and this is a good opportunity, that we do ask that medical providers report those vaccine adverse events to the Vaccine Adverse Events Reporting System, or VAERS. That's one of the ways that we continue to monitor for the safety of the vaccine as we're getting shots out to the wider swath of the population. But what I would say is, we've not seen anything specifically associated with the vaccination in South Dakota. We have seen that the initial concerns around severe allergic reactions have been less frequent than was anticipated as we get more vaccine out to the wider population. And there are anticipated some additional work by CDC to specifically enumerate what they've been seeing using the V-Safe application, where individuals are able to log what symptoms they're experiencing for the first week, plus several weeks and months afterward. And I can say that on a weekly basis now, I'm getting, I'm registered for that V-Safe, and it asks some very basic questions about symptoms that you're experiencing and so on. And so I would also recommend that folks who are getting vaccinated download that QR code, get registered, and participate in the safety monitoring.
Okay. Can we please have the next question?
Jeremy Fugelberg, Forum News Service.
I heard Jeremy.
Yeah, thanks. Just checking to see North Dakota is reporting their first known case of the UK variant, that B117. Just wondering if we've seen any of the additional variants here in South Dakota.
This is Dr. Clayton. We have increased our capacity for testing for doing the sequencing in order to test for variants. That includes our collaboration with CDC as well as our laboratory testing capability in state with our public health laboratory. At this point, we have not seen that UK variant, the B117, nor any other variant at this time. But again, we continue to conduct surveillance, and we'll update folks as we identify any of those.
Okay.
Thanks.
Next question, please.
This is Jerry Oster, WNAX in Yankton. The pharmacy program is in places where there's also health agencies, so you kind of got an overlap there. Do you recommend people go to both in hopes of getting the vaccination, either or? What's a recommendation?
So, Jerry, thank you for that question. Yes, we do recommend that people understand all the options that they potentially have, and if they're kind of still in that waiting status, to sign up with any potential providers of vaccine. Now, we do want people to plan to get their second shot from the provider that gives them their first shot, so people should be prepared for that. But again, having more pharmacies now involved with this, it just gives more access points to individuals to hopefully make vaccination more convenient.
And is a vaccine total for the federal, the pharmacies, is that included in the total, or do you count that separate?
That is separate from the state allocation. And that's made directly, and the vaccine allocation to those pharmacies participating in the federal program is made directly to them.
Next question, please.
This is Jody Heemstra, DRG Media Group here.
Go ahead, Jody.
Thank you. The federal pharmacy program, kind of following up on what Jerry was just asking, the federal pharmacy program started in South Dakota. The pharmacy in Pierre that was supposed to get the supply said that due to unforeseen circumstances, they didn't get theirs. I'm just wondering if, one, that situation happened at any of the other pharmacies in the states that were supposed to get it, and then two, if we found out what caused that disruption.
Jody, well, thank you for that question. We are aware that there were some pharmacies that anticipated receiving an allocation, and those were primarily through the Cardinal Health supplied pharmacies, and did not, in fact, get an allocation to provide shots yet this week. And so we do not know the cause of that disruption. I think, obviously this was the first week that this was rolling out, and so I would expect that, to the degree there's some kinks to work out, that's going to be happening here very shortly.
Okay. Next.
Thank you.
Question, please. Can we have
This
the
is
next
Jonathan
question?
with the Argus Leader, if nobody else has another question.
1 second. Anybody else have any other questions? Hearing none, go ahead, Jonathan.
Thanks. Hey, question, in terms of vaccinations, I know several people who had already tested positive for COVID who are being queued up to be vaccinated or have been vaccinated. Do you guys have numbers on how many people who have tested positive are getting vaccinated, and was there any talk about maybe deprioritizing them because they already had sort of natural immunity?
Well, I can answer the second question for you first, Jonathan. We have not deprioritized that group, and the reason for that is, first of all, the recommendation is that folks that have had COVID still participate and get vaccinated, and so we just want to really encourage that group and not deprioritize them and have them think that it's really not something that they should do. And so, but to that end, we are not necessarily tracking individuals that have had COVID and are becoming vaccinated because the recommendation is the same. So we don't have a number to your first point.
And this is Dr. Clayton. What I can say is that, we do continue to monitor for individuals with what is termed breakthrough disease. So individuals who have been fully vaccinated and have still end up with COVID-19 infection. At this time, we have not identified any of those individuals in the state. I know there have been some reports nationally of just such a thing. But at this point, we have not seen an individual who has been fully vaccinated develop COVID-19 in South Dakota.
Okay. I think we have time for one more question. Can I please have the last question? Hearing no questions, we would like to thank you for joining us today. If you have